Hello, good afternoon, all of you, and I hope all of you are safe during these corona pandemic times. I'm Dr. Bali, Dr. Harinder Bali, Chairman Cardiac Sciences, Paras Hospital, Panchkula. I've been involved in cardiac care for the last about 30 years, and as you know, worldwide heart disease are increasing at a rapid rate, and that is the scene in our country as well. And as much as 60 million people in India are suffering from heart disease. And as you know, it's a lifestyle disease. And I am involved in intervention cardiology at present, and we do angioplasty for coronary artery disease. But that is not the solution for the epidemic of heart disease which we are seeing worldwide. And it's a lifestyle disease, and we understand that there are a number of risk factors which cause this heart disease. And all of these risk factors are lifestyle risk factors. My interest in yoga goes back to about 20 years, but I looked at literature and found out that contrary to the normal belief that this science is not tested in clinical trials, there are a lot of trials seeing the efficacy of yoga in risk factors and heart disease. And I'm convinced is a major factor by which we can not only control this epidemic, but over the next 10, 20 years, we can actually decrease the prevalence of risk factors and heart disease worldwide. Now, let's look at what are the risk factors for heart disease. We understand hypertension, diabetes, cholesterol, obesity, stress, family history are important risk factors. And we will take each one of them individually and see what yoga does to these people. Let's look at first diabetes. We know that diabetes is increasing worldwide, and so one of the most important factor in of heart disease in the world. Particularly in female, it is even more important than it is in males. And therefore, we need to look at diabetes and insulin resistance, which is important factor of causing diabetes over a period of time. We also understand that metabolic syndrome, which is increasing worldwide, is also has insulin resistance. And yoga has been tested in a number of trials to see that how does it affect patients who have metabolic syndrome or frank diabetes. And there are, although modest in volume and with a moderate amount of follow-up of about 8 to 12 months, and these trials have shown that yoga, when compared to standard care of treatment, has positive impact on these patients by improving insulin resistance and by decreasing fasting blood sugar, postprandial blood sugar, and glycosylated hemoglobin. Number of trials have been done, and the improvement has been across board. And fasting blood sugar improves by about 10 to 20%, and postprandial blood sugar improves by about similar amount, and HbA1c decreases by about 1 to 2%, which is a very major improvement in these patients. And this diabetic improvement is consistent and lasts for a long period of time. So I would say that yoga, with its various asanas and whether it is Raj Yoga or Hatha Yoga or other types of yoga, has a positive impact on diabetes and should become a part of all patients who have diabetes as a part of clinical management of these patients. As I said, in metabolic syndrome also, it has been shown to have a positive impact. The other factor is lipids. Cholesterol, we believe in cholesterol hypothesis that cholesterol over a period of time causes heart disease. This has been shown in primary prevention trials also, that patients who have increased cholesterol level, increased bad cholesterol, which is LDL cholesterol, and triglycerides also have a worse, they have increased risk of developing coronary artery disease. And studies have been done to see the impact of yoga on these lipid profile, and I could come across about 6 randomized control trial, and they showed that patients, when as compared to control, placebo treatment or no treatment, they actually show that the total cholesterol decreases by about 15 to 20%. LDL cholesterol, which is the bad cholesterol, decreases by about 10 to 15%. Triglyceride decrease as much as about 20 to 30%. And there is a modest increase in good cholesterol, which is HDL cholesterol. And these changes, decrease in LDL cholesterol, decrease in total cholesterol, triglyceride, and modest improvement in HDL cholesterol, has a positive impact on long term in these patients. And the studies have been carried out in diabetic patients with dyslipidemia, and in healthy patients also with dyslipidemia. And in both group of these people, these trials have shown that those who practice yoga under guidance over a period of weeks to months, they showed improvement in their lipid profile. So that's a very positive impact which yoga has on lipids. And there's a feeling that oxidized LDL, which is even more dangerous than LDL cholesterol, also is decreased in these patients with the use of yoga. The other factor which we need to see is that obesity continues to our part where obesity is central, what we call as the apple-shaped obesity. This central obesity, perimesenteric obesity, peritoneal obesity, cause of metabolic syndrome and development of cardiovascular disease over a period of time. Has been seen that if you do yoga over a weeks to months, then that will have a positive impact not only on decreasing the weight, body surface, but decreasing the weight of the patients, but also improving the body fat. So that is another positive impact which yoga has got. The third thing which we need to see is blood pressure. And blood pressure is an enormous problem worldwide. If you look at urban areas in India, we did some study in Chandigarh about 8 to 10 years back. And the prevalence was in urban area in people above the age of 40 years was about 40%, which is quite significant. And similar data is available from other large cities of India also and from the rest of the world as well. So prevalence in adults in urban area is to the tune of 36 to 46%. Most majority of these people have mild hypertension, and mild hypertension over a period of time causes heart disease, causes kidney failure, strokes, and peripheral vascular disease. So we treat this mild hypertension. We should diagnose it at the earliest. So because most of these patients have mild hypertension, they are asymptomatic, and we call it a silent killer because it progresses unless we get the blood pressure checked. We would not know that one has got high blood pressure. So we recommend that everybody from adolescent onwards must have his blood pressure checked to see that patient is hypertensive or not hypertensive. And we should treat it with a lifestyle modification and with medicines. And out of lifestyle modification, one of the most important factor is yoga, and it has been seen in trials. We did a study in PGI about 15 years ago, and similar is the experience worldwide that done systematically over a period of time reduces the systolic blood pressure by about 8 to 10 millimeters and diastolic blood pressure by about 5 to 7 millimeters, and that effect is consistent over a period of time. And as you will appreciate that this is a significant improvement in blood pressure, and some people may, over a period of time with prolonged use of yoga, may actually be able to not only reduce their medication for hypertension, but also completely stop them as well. So in my practice, and that is what we advise to our students and all the treating cardiac physicians that yoga must become a part of management of hypertension. Yoga, along with other lifestyle modification, be it diet or exercise, is an important component of blood pressure management. The other factor which has been seen with yoga is that it has an impact on uh, coagulation profile or procoagulants in our body. In our body, we have two streams running parallel. One is the uh, procoagulant state, and the other is the fibrinolytic state, which prevents the formation of coagulation in our body. And it's been seen that if we do yoga over a long period of time, yoga decreases the fibrinogen level and other components of procoagulant state. And this has been a consistent effect in studies. And whereas the fibrinolytic system uh, parameters improve with use of yogas. So there is a less tendency of formation of clots in those people who we also know that yoga has positive impact on stress, and stress, which may be long-standing chronic stress, has releases certain hormones in our body, which could be cortisol, which could be epinephrine, norepinephrine, and similar type of other hormones. And yoga has been shown to decrease the level of stress, and by improving the stress level, it decreases the level of these hormones, which have adverse impact on cardiovascular system of the person. The other factor which I would like to stress on is that how does this yoga act in patients with heart disease or normal people? There are two. One is by decreasing the sympathorenal adrenal system and what we call as the RAS system, renin-angiotensin system. By decreasing the effect of this decreases the circulating renin level, circulating epinephrine level, norepinephrine levels, and that is one mechanism by which it decreases the sympathetic outflow in a given patient. The other mechanism is that it has a direct impact on parasympathetic system, and it stimulates parasympathetic system. So the ratio of sympathetic and parasympathetic system in a given individual goes in favor of parasympathetic. So sympathetic activity decreases and parasympathetic activity improves in these particular patients and who practice yoga, which has a positive impact on cardiovascular system. As I said, in a large number of patients, it has been seen that use of yoga decreases the cortisol level, decreasing the circulating epinephrine level, decreasing the circulating renin system, and therefore it has a positive impact. In addition, it's been also seen that it has a positive impact on the respiratory rate, decreases the respiratory rate. It decreases the heart rate of a person through the parasympathetic system. And another factor is what we call is heart rate variability, which is an important risk factor for heart attack and sudden cardiac death. So it decreases heart rate variability, which has a positive impact. So there are a number of mechanisms by which yoga has a positive impact on risk factors of heart disease and cardiovascular system as such. So let us talk about cardiovascular system. In coronary artery disease, what coronary artery disease can usually presents with blockage in the major epicardial coronary arteries, and these coronary arteries over a period of time the blockage increases, and it can cause stable coronary artery disease, what we today call as a chronic coronary artery disease, and in which patient has angina, exertional symptoms. We do stress test in these individuals, the treadmill test or stress echocardiography or stress serum in these individuals, and that would show positivity, indicating that on exercise there is reduced blood supply to heart because of these blockages in coronary artery disease. But these are stable blocks. What is more disturbing is when these stable blocks become unstable, what we call as the ulcerated plaques or unstable plaques, in which this coronary artery disease becomes unstable. By that we mean that instead of patient doing activity or walking for a period of time and getting angina after about 2-3 kilometers and sitting down and getting relief, these individuals get angina at variable physical activity. That means sometime a person may be able to walk for 3 kilometers and get angina. Another day he may be able to walk only half a kilometer or angina. This we call as a crescendo angina. Or patient starts getting angina even at rest, where there is when there is no activity, and that would mean that the blockage in the coronary artery has become unstable, and not only the demand is angina is demand dependent, but it is also supply dependent. That means because of the variability of the blockage in the coronary artery, there is a variable block in the coronary which produces unstable angina, and that is a precursor of causing acute myocardial infarction or heart attack. And in heart attack, what we see that these ulcerated plaque rupture, and there is a formation of a clot, and over a period of time, one of the major epicardial coronary artery where this ulcerated plaque has ruptured, a clot forms, and that leads to a formation of total blockage of the coronary artery. The myocardium supplied by that coronary artery over a period of time starts getting necrosed and produces what we call as a heart attack. And this blockage in the coronary artery occurs over a period of time, and there is a lot of what we call as a coronary flow reserve, that even if one of the major coronary arteries blocked up till 70%, still patients would have no symptoms, and even a treadmill test or a stress test would be negative. The symptoms only start appearing once the blockage is more than 70%. And today we know that patients who have been prescribed systematic yoga along with other lifestyle modification, they do better than those who have been not prescribed yoga. And there are a large number of trials which have shown that these patients respond symptomatically, the angina frequency decreases, the duration of activity which they are able to do before angina comes on, that improves, and that has a long-standing effect. It also stabilizes the plaques. By that we mean that an unstable angina could become stable with the use of yoga. So it stabilizes blocks, makes patients more stable. The blocks stabilization causes stable coronary artery disease, and that has a long-term modification effect on their coronary artery profile. The other factor which has been seen, that we have been long discussing, that whether by lifestyle modification or by drugs, we can regress these blocks, that somebody has a 85% block and we use yoga and see whether the block regresses over a period of time. There are a lot of people who believe that it definitely causes stabilization, but regression may not be possible with yoga alone. But there is a large study from our Institute of Medical Sciences about 15 years back, which showed that angiographically, not only the blocks became stable, there was some regression of these blocks as well. So there is some evidence in controlled trials showing that yoga could cause a regression of coronary artery disease also, which is a very positive impact, because worldwide a lot of research is going on. A lot of trials are going on to try high doses of statin or other medicines to see if we can regress the blockage of coronary artery disease. And this trial has definitely shown that the blockage can also be regressed with yoga. So what I would say, that all these risk factors do get impacted by yoga positively. And the coronary artery disease also has a positive impact if we prescribe yoga to these individuals. So my suggestion to you would be that in addition to other lifestyle modification, which would include weight reduction, exercise, and diet control, we should also prescribe yoga to these people who have risk factors for coronary artery disease or who have family history of coronary artery disease, or who have established coronary artery disease, be it stable coronary artery disease or unstable coronary artery disease. The advantage of using yoga is that there is no known adverse effect of yoga. It can be practiced at home. There is no investment required, and it can be practiced by person himself, even without supervision. And first, if a yoga teacher teaches the patient, and then the patient learns on his own and can practice of yoga over a long period of time. So this is costless and it has a positive impact. And world is learning, for the last 5 to 10 years, the importance of yoga in preventing and controlling risk factors and in long-term prevention of coronary artery disease. So we should all make yoga a part of our daily life, because primary prevention, that we do not get even diabetes or hypertension or hyperlipidemia or obesity, can be taken care of by use of yoga. So I strongly recommend to all my patients and to my colleagues and normal people also, that let's make yoga a part of our daily routine, and so for a positive impact. As I said, I being an interventional cardiologist have done about 15,000 angioplasty, but which is a small minuscule when we look at the volume of patients which are there of coronary artery disease. The only method by which we can control this epidemic or regress the prevalence of coronary artery disease worldwide is by controlling risk factors and by using lifestyle modification. And out of lifestyle modification, I would rank yoga as one of the most important component in this lifestyle modification. So if there are any questions about yoga and its impact on risk factors of coronary artery disease or its impact on coronary artery disease, I would be happy to answer those questions. Thank you.